안녕하십니까. 김경원입니다.
Greetings, I'm Dr. Kim Kyung-won. Today, I'm going to share with you a surgical case. This is a male patient who is 47 years old, and in the lower anterior, OneMS implants were used. 2 of them were placed about 2 years ago. I've shown you a clip about that, and since then there was a problem, so it needed to be replaced. If you look at initial visit in lower anterior area, there was teeth mobility along with gingival swelling and pain. In the past, CT was taken as shown, and bridge type prosthesis was provided for number 32 and 41 after extraction of 41 and 32. In number 32, allogenic and collagen membrane were used for socket preservation. It was done like this, and in November 2021, as shown, a 3.0 by 10 millimeter MSSA implants were placed. This was utilized for implant placement, media post-op, and in number 32 and 41 after implant placement. After 3 months, this is at standard follow-up at the time. After 3 months, the patient complained that there was discomfort in the implant in the lower. When I took a closer look in number 32, there was a bit of radiolucency and the implant was mesially displaced. Therefore, number 32 was removed. In that area, Sure-Os allograft was used for bone graft and implant was placed again. In the middle, number 37 was extracted and AOS and OS guide was utilized for socket preservation. In number 32 and 37, surgery was performed again, and I'm going to show you that. If you take a look here, shell-type provisionals were provided, and if you look at after 3 months, in number 32, the patient complained of discomfort, and even if you see with your eyes, the implant was slightly labially displaced. Therefore, I had no choice but to remove it. In number 32, implant was removed. The allogenic bone was used for bone graft. In number 37, there was pain as well as mobility. Therefore, it was addressed. You can see that there was significant periapical lesion and it was removed. Bovine bone AOS and OS guide collagen membrane was used for socket preservation in number 37. In number 37, socket preservation was done, and this is after 2 weeks. And in number 32, after implant removal, at this point, it's been 4 months. If you look at standard X-ray, there's no major issue, and there's nice healing. In number 37, this is 1 month and a half later socket preservation. In number 32, implant was removed, and this is after 5.5 months. On CT, it looks okay. Because this was where implant was removed, the bone was quite dense. The medular portion looked more dense, so I decided to use a longer implant upon implant replacement. In number 37, so we tried to place the implant more towards the mesial wall. One guide team was consulted and surgical plan was formed in number 32 MS narrow ridge. The diameter was reduced to 2.5 and the length was increased to 11.5 millimeters. MS implant was like this, and gingival height was 4 millimeters. If you look on CT, the bone showed a sclerotic change, so I chose longer implant and placed it deeply. In number 37, KS3 BA surface 5.0 by 8.5 was planned. Narrow ridge MS implant drilling sequence. In my case, for 2.5, I use final drill of 1.8. In the case of OneMS, there's black laser marking on the implant driver. In the case of gingival height of 2.5, you put it in fully. Of 4.0, if you can match to the lower part of the black laser marking, then you have no problem doing depth control. Look here, in number 32, replacement was done, and in number 37, implant was placed. This is post-op x-ray. Immediate post-op in number 32 up to the desired point, it has been placed deep, and in number 37, implant has been placed in the planned area. This final restoration was delivered 4 months after surgery in the lower anterior. Such final restoration was provided, and final restoration was provided for number 37. If you look at standard x-ray in the right, the implant was changed to narrower diameter and gingival height was 4 millimeters. MS implant was used. This is 1 year post-op x-ray in number 37, even after a year. It's nicely healed. And in number 32, after a year, the implant was still nicely maintained. Labial wall looks nicely healed. In number 41, which was placed earlier, even after 1 year and 10 months, there are no major issues. This panoramic image was taken 1 year and 7 months later. The reason why I'm showing this is because by using OneMS, after placing one body implant, at times there can be issues, and because of such issue, I removed it and placed another implant. I used a narrower implant more deeply, and gingival height was 4.0. And this case was successfully closed. Let's see the clip. If you take a look over here in number 41, there is MS implant, which was placed earlier. One guide template is adapted. One guide is fitting nicely. This is tissue punch from number 7, the posterior area. I am going to begin. Tissue punch is used to remove overriding mucosa in number 37. Template is removed, and after checking tissue removal, flattening drill is used. In number 37, the bone that exists are removed here. Initial drill that fits the wide hole is used. A 3.5 by 8.5 one guide drill is used. In number 37, template close type is used for drilling. Because it is number 37, visibility is tough. Next, a 5.0 by 8.5 one guide drill is used. Because it is number 37, because my hand obstructs the view, I apologize for you not being able to see it properly. You can see that the bone is slightly hard. Drilling up to 5.5 by 8.5 was done, and cortical drill is used here. There's a 5.5 drill option. KS3B a 5.0 by 8.5 implant is positioned because it is BA surface. It is irrigated first before placing the implant in the right position. As you can see, torque wrench and implant driver is used. Final stability is over 30 Newton centimeters. In OneMS kit is used to place the implant again in the anterior zone. Tissue punch is used to remove overriding mucosa in number 32. Because this is an area where implant failure occurred, I paid more attention. Flattening drill is used to remove overriding bone. This is OneMS kit. This is 1.5 by 8.5 1MS drill. In the case of 1MS, the drill is narrower, so we need to pay more attention. 1.5 millimeter drilling is done. This is 1.5 by 11.5, and the following double concept, shorter drill is used, and then it's done full length. Because this is a narrow, we need to be careful. This is 11.5 by 1.8. I am drilling full length. Final drill up to 1.8 is done, and then this is 2.5 by 11.5 1MS implant. This is as a surface as shown. A longer implant of 11.5 millimeters with 4 millimeter gingival height is used. Because this is an area where implant failure occurred, the implant is placed deeply up to the bottom part of black laser marking. Then, because it has a 4 millimeter gingival height, it will be problem-free. Primary stability is favorable, over 30 Newton centimeters, and only up to the bottom part of black laser marking. It is placed. Primary stability is over 30 Newton centimeters, and in number 7, ISQ value is measured. 74, 72 ISQ values are favorable, and in number 37, healing abutment is connected. This is after surgery. This is posterior and anterior. In number 32, it is placed more deeply. In today's surgical clip, at times failure can occur when placing implants in the lower anterior area, and it can become quite challenging. In this case, I used allogeneic bone here in the field area and waited sufficiently after observing CT because the bone seemed more dense. I chose implant with narrower diameter and a longer length. So the implant was placed quite deep, and I was able to restore the failed implant and place the implant successfully. Thank you for watching.